Resuming debate, the honourable member for Nanaimo Cowichan for her 5 minutes of reply.
Great. Thank you very much, Mr. Speaker. And I want to begin by acknowledging many of my colleagues and also members from the Liberal Party who are speaking up in support of this important piece of legislation. And I have to admit to feeling some frustration after listening to the Conservatives outline a program that's clearly not working. If it was working, I wouldn't have to stand here in this House and propose a piece of legislation to deal with the problem. We know throughout Canada that there are hundreds of derelict vessels, both on coastal waterways and in inland waterways, and this is a problem for many, many members in this House from coast to coast to coast. So I'm baffled as to why the Conservatives will not support this first step, and I acknowledge it's a first step. And in my brief period of time, I want to tackle a couple of concerns that they've raised. First of all, there seem to be four main areas where the Conservatives say they can't support the bill. The first one is they say that this would force the Coast Guard to deal with every derelict vessel, which would adversely affect their operational capacity. Well, Mr. Speaker, if they had read the bill, they would understand that I included a provision that would allow the minister to set out in regulations the circumstances where the receiver of wreck was not obligated to take measures to deal with a derelict vessel. By doing so under the regulatory process that allows the public to have a say in what and when they think vessels should be dealt with by the government. And Mr. Speaker, clearly the intention of this bill is not to have the receiver of wreck, the Coast Guard, deal with absolutely every derelict vessel, but we already know that the problems that provincial governments, municipalities are having, which has been ably outlined by members such as the member from Esquimalt-Fuka, how difficult and complex it is for other levels of government to deal with this, and that we do need some clear definitions about when a derelict vessel needs to be apprehended. The second part is the Coast Guard. The Conservatives say that the Coast Guard is not a standalone department. It is part of Department of Fisheries and Oceans, so it cannot be made a permanent receiver of wrecks. Well, actually, under the Act and the regulations as they currently stand, the minister can designate any entity or individual as a receiver of wreck. The status as a standalone entity doesn't matter because the power to designate still resides with the minister. So this bill does not change that ability to have the minister designate the receiver of wreck. Thirdly, the Conservatives are claiming that the cost of dealing with derelict vessels will now be borne by the government and ultimately by the taxpayer. And that is nonsense. We've already seen that the government is currently already having to pick up expenses. Again, the member from Esquimalt-Fuka pointed out the $40,000 that was spent in cleaning up a vessel, and then the additional $100,000 that had to be spent in dealing with a derelict vessel when it had been torched and otherwise dismembered. So nothing in this bill removes the obligation on the owner of a vessel to pay for its disposal. That is why the receiver of wreck must take all reasonable steps to contact owners before taking action, because those owners are responsible for paying the costs. And as currently happens right now, every effort is made to track down the owner and have them pay for those costs, but we also know that there are many cases where it's simply not possible to identify the owner. They're deceased, they're out of the country, whatever. So, Mr. Speaker, it still is incumbent upon the owner to be responsible. If we wait for all derelict vessels to become navigation or environmental hazards, the cost of dealing with them goes up. And again, we've seen that in cases. The longer a vessel remains derelict, the more costly it becomes to remove it. By giving a receiver of wreck the ability to contact the owner upon observing a wreck, this legislation may help prevent vessels deteriorating to such a point that the removal or disposal becomes a costly burden. And finally, Mr. Speaker, the government is proposing a public relations exercise that's going to tell owners about their responsibilities. I have to tell you, many owners already recognize that there's a life cycle issue with vessels, but part of the problem is there's nowhere to recycle these older vessels. And again, my colleagues have pointed out there's actually a business opportunity in recycling these vessels. So, Mr. Speaker, I am hoping that some members of the government will recognize that these derelict vessels are serious problems in their own riding, and that they'll actually have the courage to stand up and support Bill C-638 so that we can take this very important first step in dealing with a problem that this government has ignored for the 11 years that I've been elected. Thank you, Mr. Speaker.
Order. Is the House ready for the question? The question is as follows. Ms. Crowder, seconded by Mr. Cleary, move that Bill C-638, an act to amend the Canada Shipping Act, 2001, Rec, be now ready second time and referred to the Standing Committee on Transport, Infrastructure and Communities. Is it the pleasure of the House to adopt the motion? All those in favour of the motion will please say yea. All those opposed will please say nay. My opinion, the yeas have it. Pursuant to Standing Order 93, the Recorded Division stands deferred until Wednesday, May 13, 2015, immediately before the time provided for private members' business. Order à l'ordre à ce moment-ci.
Pursuant to Standing Order 38, a motion to adjourn the House is deemed to have been made and seconded at this time. Therefore, the question is the following, that this House do now adjourn.
Member for Thunder Bay, Superior North.
Mr. Speaker, we Canadians are getting older. The percentage of Canada's population over 65 has nearly doubled since the early 70s. As our population ages, the strains on our healthcare system are continuing to grow. Dealing with this situation will not be easy. In a response to my question, the Secretary to the Minister of Health spoke about innovation. Innovation is exactly what Canada's healthcare system needs, but it's not what we're getting from the Conservatives. The Conservative approach to dealing with Canada's health problems has been to evade and download the issue onto the provinces and pray that costs will somehow get better. They refuse to plan ahead. In Thunder Bay Superior North, our seniors are being stacked up in temporary cots in hospital hallways due to a lack of beds. Our system is overburdened by inadequate federal funding and a total lack of long-term planning. We're the only country in the G20 with no national health care strategy. As Canada's population gets older, our health care woes are only going to get worse if we don't start making some serious plans and taking action. We must invest in long-term solutions for our healthcare system. Continuing care is now incredibly excluded from the Canada Health Act, if you can imagine. By contrast, Nordic and European countries have long-standing public, comprehensive, universal, and tax-financed continuing care programs. Chronic disease management programs require a multidisciplinary approach designed to encourage adherence to medications and lifestyle changes and promote prevention and patient self-management. Such programs can reduce complications, avoid costly readmissions to the hospital, and improve survival and quality of life. Our federal government needs to stop forcing those who do need long-term care onto emergency facilities that weren't designed and aren't equipped to deal with their needs. Up to 90% of seniors deal with at least one chronic disease. Treating those diseases amounts to 67%, two-thirds of all health care costs. On any given day, patients approved for hospital discharge who can't access appropriate post-hospital care occupy about 7,500 beds across Canada. This government needs to develop a national health care strategy with a focus on dealing with chronic diseases through investment in preventative, long-term, and home care. There's a huge shortage of long-term care facilities in Canada, and as we get older, demand is only going to go up. Many provincial governments have recognized the need for these facilities and have begun investing in them. The Conservative federal government needs to step up and join them. Investing in home-based care is a very practical strategy. An astonishing 13 million Canadians already provide some kind of home-based care to their own family members or friends with long-term illnesses. 96% of Canadians support public policy changes that would allow seniors to age in their homes while receiving effective home-based care by professionals. The Canadian Nurses Association, as well as numerous healthcare experts from across Canada, have advocated heavily for long-term and home-based care. Every time someone can't find a room at a long-term care facility and is forced to go into a hospital, they're costing taxpayers. A hospital bed costs the taxpayer 6 times what a long-term care bed costs and around 20 times what home care costs. When will this government listen to the experts and invest in long-term care strategies that work and dramatically lower costs in the long run? Thank you, Mr. Speaker.
The Honourable Parliamentary Secretary to the Minister of Aboriginal Affairs.
Well, thank you, Mr. Speaker. I'm pleased to address the honourable member's comments regarding the performance of Canada's healthcare system in the face of an ageing population and changing healthcare needs. Our government is committed to a publicly funded, universally accessible healthcare system. While provinces and territories have primary responsibility for delivering healthcare federally, we will continue to provide significant support through fiscal transfers as well as targeted initiatives to foster improvement in critical areas. Since taking office, our government has increased the Canada Health Transfer by almost 70%. Federal health transfers to provinces and territories are at an all-time high, on track to increase from $34 billion in 2015-2016 to more than $40 billion annually by the end of the decade. This represents a record investment that provides the provinces and territories with the financial predictability and flexibility to respond to priorities and pressures in their respective jurisdictions. For example, this funding enables them to further develop their own home care and long-term care programs and services to respond to the unique needs of their senior populations. Mr. Speaker, our government is committed to the health, well-being and quality of life of Canada's seniors and recognizes the importance of home care and long-term care as an effective means of delivering the type of care required while reducing unnecessary pressure on hospitals. We recognize that many older adults would prefer to remain in their own homes for as long as possible. That is why Budget 2013 announced expanded tax relief for home care, including services such as bathing, feeding, and other personal care. However, we also know that money alone is not going to enable our healthcare system to address the complex challenges posed by an aging population, increasing rates of chronic disease, and slower economic growth. We know it is also important to explore innovation so that Canada's healthcare system can adapt to this new reality, continuing to provide the quality care that Canadians expect over the long term. Mr. Speaker, the Government of Canada is the single largest investor in healthcare innovation, with more than $1 billion invested annually to support health research, knowledge development, and positive change. For example, through Budget 2015, we will enhance our ongoing support of Canada's Strategy for Patient-Oriented Research, or SPORE, increasing our investment by $13 million to the Canadian Institutes of Health Research to expand this initiative. SPORE aims to align research, innovation, and health systems to ensure that patients receive the right treatment at the right time. Looking forward, we are committed to working with provinces, territories, and stakeholders to strengthen Canada's healthcare system for all generations through research and innovation.
The honourable member for Thunder Bay, Superior North.
Mr. Speaker, our hospitals are not intended or well equipped to deal with preventing and treating chronic diseases. This government's lack of planning is forcing us to ship our seniors off to overcrowded and expensive emergency care facilities instead of providing them with appropriate long-term care. We must invest in long-term care and home-based care for seniors in Thunder Bay, Superior North, and across Canada, partly in order to free up acute care beds in the Thunder Bay Regional Health Science Centre. Investing now will save the taxpayers millions in the long run, billions actually. If this government truly believes in innovative policy, then when will it start investing in it? The feds and the provinces used to each pay 50% for health care costs. Today, the federal share is less than 1/2 of that. Mr. Speaker, when will we see some adequate funding? And, Mr. Speaker, when will we see some real evidence-based health care policies for Canada? Thank you, Mr. Speaker.
Honourable Parliamentary Secretary.
Mr. Speaker, I'd be happy to expand on our government's commitment to innovation in long-term care and preventative health care. One example is Economic Action Plan 2012 provided $6.5 million over 3 years for a research project at McMaster University to explore how the use of technology in primary health care can improve continuity and cost-effectiveness of care particularly for at-risk seniors. In Budget 2013, we also announced $3 million in funding to the Pallium Foundation of Canada to support training in palliative care to frontline healthcare providers. To summarize, our government is committed to Canada's system of publicly funded healthcare and improving care to seniors. We placed health transfers on a sustainable and predictable growth path, and we will continue our investments in research and innovation in partnership with the provinces, territories, and stakeholders. Thank you, Mr. Speaker.
The honourable member for Algoma, Manitoulin, Kapuskasing.
Thank you, Mr. Speaker. Mr. Speaker, one of the sad and seemingly inevitable events we witness every winter is an inordinate number of house fires on First Nations that take people's lives. Often the lives lost are those of people who have been sacrificed due to the absence of a regulatory regime for fire services and inspections in First Nations, which means there are no minimum requirements to be met. The problems with fire services are only compounded by the persistent, and one could argue permanent, lack of suitable housing available on First Nations. For too many of these communities, the lack of adequate housing means that overcrowding only complicates the matter. In addition to the many health-related problems that arise from overcrowding, there are also risks related to fire safety. Crowded houses that are not built to be fire safe in the first place are then heated with rudimentary wood stoves, which result in the same sad headlines every winter. It is said that the definition of insanity is doing the same thing over and over again and expecting a different response. But that is exactly what this government is doing. Either they are satisfied with runaway statistics that make house fires on First Nations that much more deadly, or they are fooling themselves that the federal response to the problem is adequate. The fact is that fire deaths are 10 times more likely to happen on First Nations than they are in other communities, which indicates there is a real problem with the government's approach. When the Conservatives were elected, they liked to say that they would do things different than the Liberals, but apparently that doesn't extend to the 2% funding cap for First Nations, which is at the heart of so many challenges on reserves across the country. It is responsible for getting nowhere on chronic problems like those related to education, housing, and what we are discussing tonight, firefighting services. The refusal to remove the 2% cap only handcuffs communities. Those that are lucky enough to have a fire crew are forced to respond with equipment that is old and outdated. That is because the money the government does allocate for fighting fires on First Nations is a drop in the bucket when one considers how far $26.3 million goes once it is divided by more than 600 communities. For the sake of an example, consider the situation on the Makwa-Saigakan First Nation in Saskatchewan, where a fire this winter took the lives of 2 children. While that community does have a working fire truck, what it doesn't have is proper equipment or a crew with the training to use it. They had an agreement for fire services with the nearby community of Loon Lake, but that agreement had been cut by Loon Lake over non-payment of bills by the First Nation. So when the call went out for the emergency on the reserve, the police responded to the 911 call and the fire crew didn't. As you can imagine, this created friction between the communities that was totally avoidable, and the government could have avoided the problem altogether if they chose to fund First Nations firefighting services to the level of need. It is a matter of making the lives of people on First Nations a priority instead of an afterthought, Mr. Speaker. So, Mr. Speaker, I ask, will the government recognize this crisis and work with these communities so they get the protection they need and deserve? Or will the government continue to turn a blind eye and continue to put people at risk?
Honourable Parliamentary Secretary to the Minister of Aboriginal Affairs.
Well, thank you, Mr. Speaker. And of course, the health and safety of First Nations communities is a priority for our government. Our government is committed to supporting First Nations and providing community services on reserves that are comparable to the levels of service available to non-First Nation communities. This principle certainly applies to fire protection as well. In order to ensure that First Nations receive the level of support for fire protection as non-Aboriginal communities, our government will continue to provide funding to First Nations for fire prevention and work with willing partners to raise awareness of simple and cost-effective prevention and mitigation strategies. To that end, our government provides an average of approximately $26 million annually for fire protection. These funds are managed by First Nations and are used to finance equipment and infrastructure, operations and maintenance of fire protection equipment, and firefighter training. This funding is provided directly to the First Nations, who are given the authority to decide how to best use these resources to protect their communities. Funding is provided to First Nations on an annual basis to prioritize their spending to meet the needs of their communities, including fire protection services. Mr. Speaker, everyone has an important role to play in fire prevention. We all play a role in ensuring that all homes and families are prepared in the event of a fire, and to ensure that First Nations have the tools they need to keep their communities safe. Raising awareness about the importance of fire safety and prevention throughout the year is an important part of our government's efforts to prevent fires and fire-related injuries in First Nation communities. Our government and the Aboriginal Firefighters Association of Canada have teamed up for the national year-round Be Fire Safe awareness campaign. The Be Fire Safe campaign features a series of seasonal fire prevention and safety tips that are being promoted through radio features, various social media, and websites. The focus is to highlight the importance of fire prevention throughout the year, both inside and outside the home, with the aim of reducing fire-related deaths, injuries, and damages. Raising the level of awareness about the need for fire safety in First Nations communities is something that this government takes seriously. Mr. Speaker, our government believes that all Canadians deserve to feel safe and secure in their homes, no matter where they live. That is why we're actively working with willing partners to ensure First Nations on reserve across the country meet this rigorous standard. Thank you, Mr. Speaker.
The honourable member for Algoma, Manitoulin, Kapuskasing.
First Nation communities are willing partners. This government isn't. I include a quote from the AFN Ontario Regional Chief Stan Beardy, Mr. Speaker. He asked, if there's no fire equipment on First Nations, if there's no reporting requirements for fire protection, if there's no fire inspection, how do you ensure you're meeting some standard to make sure there's safety? End of quote. The answer is that you can't ensure anything, and at best you're merely hoping all goes well. But statistics prove that things aren't going well at all. There is a reason for that, and that is the current level of funding, which is handcuffing First Nations who would like to beef up their firefighting capabilities, but find they simply don't have the money to do that. The problem is so bad that no First Nation in Ontario has been able to purchase any equipment in 3 years. If that were happening in other communities across the country, people would be up in arms. The fact that so many of the communities we are discussing are remote only makes the problem more pressing. Mr. Speaker, First Nation lives matter. Will the government do something about the crisis in firefighting capabilities on First Nations so that we can put a dent in the number of preventable deaths and that are the result of horrible house fires in those communities every winter?
Parliamentary Secretary to the Minister of Aboriginal Affairs.
Thank you, Mr. Speaker. And as I've said, our government takes the health and safety of First Nations communities very seriously. Our government is supporting First Nations to ensure that they have the tools and the education they need to keep their communities safe. That is why we are teaming up with the Aboriginal Firefighters Association of Canada to raise awareness of potential fire hazards throughout the year. Our government understands that we all have a role to play in preventing fires on reserve. We know that fire prevention programs in Aboriginal communities can make a positive difference in reducing the number and severity of fires on reserve and can certainly save lives. Thank you, Mr. Speaker.
A motion portant que la...
A motion to adjourn the House is now deemed to be adopted. Therefore, the House is adjourned until tomorrow at 11 o'clock, pursuant to Standing Order 24-1.